Hi everyone, I'm Dr. Akhila, consultant, fertility specialist, the Hospital, Banjara Hills, Hyderabad. Today we are going to talk about the role of embryo transfer. So embryo transfer is the most important step in the whole of IVF, wherein after we collect the eggs, we mix it with the sperm, create embryos. Now these embryos are transferred into the uterus. Now this is the last step and it is the most important step, and after about 2 weeks of this embryo transfer, we get to know whether the pregnancy is positive or not. Now, let us understand how this embryo transfer is done. What is the procedure of it? So, it is a very simple procedure. No anesthesia is required, and on the day of the embryo transfer, the woman comes in with a full bladder, and she need not be in a fasting state. And a pelvic examination is done, and the speculum is placed, cervical mucus is cleaned, and a catheter, a soft catheter with an ecogenic tip, is introduced. The outer catheter is introduced till a little into the internal os, and then the inner catheter is placed inside the uterine cavity, inside the endometrium, about 1 to 2 centimeters away from the fundus, and the embryos are transferred. This is typically done under the ultrasound guidance. And after the embryo transfer is done, it's a very important step that the embryologist takes the catheter and checks whether the embryos are retained or not. So this is typically the embryo transfer. It takes about 10 to 15 minutes. And after the embryo transfer, within the next 10 to 14 days, the pregnancy test is scheduled in the form of a urine pregnancy test or a serum beta hCG. And let us understand there are two different types of embryo transfers that we can do. One is a fresh embryo transfer, the other is a frozen embryo transfer. So the fresh embryo transfer would mean that the embryo transfer is being done in the same cycle as that of egg retrieval. So in the cycle wherein the eggs are retrieved, mixed with the sperm, the embryos are created. We don't freeze these embryos, we directly transfer these embryos in the same cycle. So for this to happen, there are a few prerequisites that need to be fulfilled. As the hormone levels that have to be in the normal range, and the woman should not be at a high risk for ovarian hyperstimulation syndrome. So some of these things that have to be taken care of, and then proceed for a fresh transfer. Most often, we nowadays follow a frozen embryo transfer, wherein the embryos are, after they're created, they're frozen, and in the subsequent cycle, we transfer these embryos after preparing the uterus. So the preparation of the uterus can be in different methods, that is a hormone replacement therapy or modified natural cycle or a natural cycle. So most often what clinicians usually follow is a hormone replacement therapy. And nowadays it is said that the lesser the estrogen exposure, the better it is. There is a minimum of 7 days of estrogen exposure that we recommend. And after the endometrium reaches about 8 mm, the embryo, the progesterone injections are started, and after that, the embryo transfer takes place. Now, this embryo transfer depends on whether we're transferring a day 5 embryo or a day 3 embryo. So, day 5 embryo is called as a blastocyst, and it is transferred on the 5th day of the progesterone injections. The day 3 embryo is a cleavage stage embryo, and it is transferred on the 3rd day of the progesterone injections. This is how we normally time the embryo transfer. So when we do the embryo transfer depends on what kind of the embryo we are transferring, whether it's a day 5 or day 3 embryo. And after this, the success of this embryo transfer after an IVF cycle is about 50 to 60% and not more than that. So this is very important that the patients understand embryo transfer is not 100%. And to increase the success rates, we do have certain protocols. also depends on the number of embryos that we transfer. So not more than 3 embryos are to be transferred. If the woman is healthy and young, less than 30 years, we prefer to do a single embryo transfer. And between 30 to 35, maybe about 2, or maybe more than 35, we can go up to 3 embryo transfers. It also depends on whether the woman has had a previous cesarean or not, or any other scars on the uterus. So typically 1 to 3 embryos is what we usually transfer. Now, how do we increase the success of this embryo transfer technique? Importantly, there are three main steps. That is, one, prefer to do a mock transfer. That is, you understand the cervical canal, the length, and how to place the catheters. A mock transfer is worthwhile to do. Ultrasound guided technique, so we know where we are and how to negotiate. Also, the embryologist checking the catheters after the transfer process to know whether there is any retention of embryos or not. These three things that are very important to follow to increase the success rates of embryo transfer. What can we expect after an embryo transfer? Mild spotting or mild cramping pains is normal, and we can expect this to happen as implantation bleeding. So these are not something that you should be worried about. And the other very important thing, we need to understand who can do this embryo transfer. So when you know the technique and how to do it, it can be done by a fertility specialist, and no advanced training is required to do this kind of a simple embryo transfer process. So these are some of the important things that we have spoken about in the role of embryo transfer. Any questions, please? Can I resume work after the embryo transfer? Or bed rest is definitely not recommended. After the embryo transfer, that one day you can rest for a while and probably avoid travel, but no bed rest is required. You can resume all your routine activities. You can go to work. All of them can be done. Bed rest is something that we don't recommend, or as a matter of fact, it is contraindicated. Can we eat pineapple or papaya? There are no studies that say that you cannot eat papaya or pineapple, but a lot of our people and the families, we all believe that pineapple and papaya are quite detrimental. So better to avoid pineapple and papaya. That is what I tell all my patients, that there is no specific study which says that you need to avoid pineapple and papaya. But if something is told by many people, told at home, better to follow. So between frozen and fresh embryo transfer, the success rates are the same. There is no added disadvantage with a fresh transfer. So for people who don't have enough time, or fresh transfer, since it's done in the same cycle, it's slightly cheaper than the frozen transfer. So these kind of women can opt for a fresh transfer. The only thing is that medically they should fit into the criteria of being able to do the fresh transfer, that is the hormone levels, the progesterone levels before we start the transfer process, the estrogen levels. She should be at a low risk for ovarian hyperstimulation syndrome. These are some of the things that we need to take into consideration before we can plan a fresh transfer. Please give any tips you felt worked for your parents during embryo transfer. Uh, so the tips that I have already discussed is medically the ultrasound guided procedure, the mock transfers, and the catheter placement, and from the patient point of view, to follow the prescription quite religiously. That is the most important thing. and minimal bleeding or cramping is normal, to not panic, to not actually go through complete bed rest, that is a little detrimental, to follow their daily routine, reduce on the stress, avoid alcohol smoking, and cut down on the caffeine intake as well, healthy lifestyle, good diet, which includes fruits, vegetables, nuts, seeds, plenty of water. These are some of the things that can give you a positive pregnancy test. So, how do you come to a conclusion that certain treatments will help in? Um, it all depends on the patient profile, the medical tests, what the couple is looking at, what kind of treatment that they want to undergo. So this is an individualized treatment, fertility treatment. It is not. It's a balance between what the couple wants, how long are they married for, how long have they been trying, uh, their emotional and financial status that needs to be taken care of. So put together, we offer them a treatment that is medically the best, but sometimes they're not able to take that kind of treatment. They come up with something else, and we can offer these kind of couples the treatment that they are looking at. So typically, IVF treatment consists of OITI cycles or OIUI cycles in IVF. So when a couple wants, probably they're supposed to go for an IVF, and then they come and ask, can we just try one IUI cycle because we've never really tried. Probably if you're doing the IVF cycle because the egg count is less, maybe 3 and 3, the AMH is also maybe 1 or less than 1. So these kind of couples, we can try one IUI for them before we start an IVF. So this is something that is individualized, and it all depends on giving them the right information, the complete information, and allowing them to choose the kind of treatment that they want. So embryo glue, definitely it's not the body's fault if it's an IVF pregnancy, if it's a negative pregnancy test. So embryo glue is nothing but hyaluronidase. Normally, the media that we use for an embryo transfer has a bit of hyaluronidase, about 5%. The embryo glue has about maybe 10% of hyaluronidase. Now, this helps in attachment or implantation of the embryo. It is not something that is a must. There have been pregnancies that implanted even without using embryo glue. So it is not something that you must use, but sometimes it is better to use when you've tried all other methods and you've not got a pregnancy test. So if finances are something that you can cater to, you can go for embryo glue, but definitely remember it is not something that is like a should and must. Uh, Day three embryos, you have two day three embryos. So better to go for a day five embryo. We do a day three embryo transfer when we think that the embryos may not survive outside the uterus. So we transfer these day three embryos. It is at least better to transfer 3 day 3 embryos rather than 2 day 3 embryos. Then if you have only two, it is better you go for a pull-up cycle, go for another cycle, and try to improve the number of eggs that you can get, the number of mature eggs, so you can make more embryos and transfer these better embryos. Yes, one more cycle is definitely recommended if it's possible. So embryo transfer, the success rate typically is the same for whether it's a fresh embryo transfer or a frozen embryo transfer. It all depends on how the hormone status of the woman is in a fresh transfer. Fresh transfer means that we're transferring the embryo in the same cycle as that of the egg retrieval. So if the hormone levels, if the progesterone and the estrogen levels are within what is expected, then we can definitely go for a fresh embryo transfer. Also, if she's at a low risk for ovarian hyperstimulation. Otherwise, frozen embryo transfer. Frozen embryo transfer also, you can plan your transfer cycle if you're choosing to go for a frozen embryo transfer. Nonetheless, we transfer only about 2 or 3 embryos. So the rest of the embryos, we need to freeze them even when we're going for a fresh transfer. So these are the details about the frozen and the fresh transfer. Thank you.